Recently, Armenian American Health Professionals Organization AAHPO's members and guests got together for a dinner meeting which was focused on Armenian Wounded Heroes Fund. After the reading of AAHPO's statement, the president of the organization, Dr. Larry Najarian, welcomed everyone, briefly spoke about AAHPO's past and future programs, and introduced the keynote speaker of the day, Razmig Arzoumanian, founder of the Armenian Wounded Heroes Fund. During his slideshow presentation, Razmig Arzoumanian spoke about numerous topics, including death from penetrating trauma, as well as statistics and concrete numbers of life-saving kits deployed in Artsakh. Mr. Arzoumanian also spoke about advanced training for Armenian medics, Artsakh strategic deployment plan, monitoring missions to confirm operational readiness, and statistic on number of lives saved.
What the U.S. Army has found out is, in Iraq and Afghanistan, 20% of the deaths that the U.S. Army was having were preventable. So if they had certain pieces of equipment with the soldiers, and if the soldiers were trained on those, they could prevent 20%. And we'll talk about what they are. But in Armenia, actually, it's a lot higher because we're not doing, we're not going to some other country and in expeditionary ways. We have our positions, we're closer to our hospitals. So what are the three causes of deaths for combat soldiers that we can prevent? The biggest one, as we talked, is hemorrhaging. So let me give a pop quiz to the physicians here. If you have a major artery punctured in your legs or arms, how long, if you're in the trenches, how long do you have to survive? How many minutes? The major.
Maximum 7 minutes.
Maximum, right. It's about 3 or 4 minutes, right? So imagine our guys back in the 90s and now, before they had certain equipment, they were bleeding to death in the trenches. And only because we didn't give them something called the tourniquet, combat application tourniquet, which costs $20. And this, what happens is any soldier can put this on themselves, on the extremities, and completely stop bleeding. This is the only thing that stops bleeding 100%. And when you put this on, you have 8 hours to get to the hospital. So this is one example of medicine and the military intersecting.
Warriors Project is a charitable organization solely dedicated to saving, supporting, and empowering Armenian soldiers wounded in combat. To this day, the organization achieved impressive results, including funding combat casualty care capabilities through advanced first aid kits and training, physical and mental rehabilitation, jobs and education programs for wounded warriors, among others.
This school is now generating 50 combat medics, very highly trained, US level, NATO level combat medics every 3 or 4 months. So every year we get 150 combat medics, and they ship them right away to Artsakh. And we put a squad bag on them and they go. So the way we did this over the last couple of years, we targeted, and we kept this very secret, now we can talk about it. We targeted the 2 heaviest fighting regions, Hadrut and Mardagert, initially in the pilot program. We had 3,000 kids. Last year we had about 75% of Artsakh completed. And then now in 2018, there's only a couple of small regions in Artsakh that will get this, and then the rest will go to Tavush. So we'll have covered 100% of Artsakh. We then go and, because many people ask, how do you know what's getting there, and they're not stealing it along the way. The good news is nobody can sell this on the street. You wouldn't know what to do with it. But so we go and monitor. So these are pictures I've taken and others. Down to the front line, and every single soldier we've seen has their kit with them. They get retrained every 2 weeks on how to use a tourniquet. And and you would have seen the videos on our website. Every time we see a combat medic, we ask them, open your bag, explain to me what's in there, do you know how to use it? And they do a perfect job.
He concluded his presentation by outlining the cooperation with AAHPO, which included raising community awareness and providing medical supplies.
So what can we do? Why are we here? Why are we talking with AAHPO? Here's some ideas, and we can open it up for more discussion and ideas. The most important thing is as much as I can yell and scream from the rooftop, nobody's, or very few people can hear me. So not a lot of people know what we're doing. And my experience is once they find out what we're doing, they get pretty excited. That's almost across the board. So we're at a point where we ask, I was saying earlier, we do a big fundraiser in LA. We ask people to give $500. Many people give 10,000, right? Because this is real. So just help us, evangelize with us if you can. The second is something many of you have access to, any excess hospital supplies. Give it to us, we'll take it there. There was a case, and it's incredible how useful they find it. So we got a frantic call from the head of the medical agency, the Army, saying, we're missing some things, we need to operate on some guy, and so forth. And it turns out that I had left a suitcase full of supplies there that they hadn't delivered yet. So they delivered that. They opened it up. They needed a mesh, like a hernia mesh, essentially, which costs like nothing here, right? That's what they needed to operate on this guy. So they opened it up. They were elated to find it, used it, operated, and the guy was saved. So little things like that can make a big difference. More complicated. So advice for the surgeons and healthcare professionals in the military hospital system. You're doing some of that already, which is great. So can we do more with your expertise? Because we're not going to try to recreate a health group for the military. Can we get volunteers from your network to assist where possible? Today in Poti, we have a 40-foot container on its way to Yerevan of medical hospital equipment. There's an organization in Ohio called MedWish International, I don't know if you know them, so they collect donated supplies from US hospitals. We pay them just a fee, and for free, essentially, they give us all those supplies. So we've stacked the full container. It's going to get there in a few days. But some of the members from AAHPO have also, if they work at hospitals, they've been donating equipment and supplies to us that we take over. So over the course of the last year, we've had 5 or 6 shipments to the main military hospital. So when you hear about a soldier making it to Yerevan and he's getting medical care, not only have we saved him on the front line, we're providing equipment that he needs in the hospital. When they get out of the hospital, they need rehabilitation. So we started a program to do rehabilitation in Yerevan. So the guy you see, that's Avedi Sarkaryan in the hospital, this was the most heavily injured soldier in the April 2016 war. He was completely paralyzed. And he was on his bed for about 8 months by the time we got to know him, and nobody had heard of him. So we funded his rehabilitation in Moscow, and if I could show you the video, he is now almost at a point he can walk on his own. Yeah, after being paralyzed and just bedridden for months and months. So without a lot, with just guys like us in this room, we can make things like this happen.
The event ended with engaging Q&A, during which Mr. Arzoumanian answered questions. The readiness from the gathered audience to help this vital organization was apparent throughout the evening. The importance of Armenian Wounded Warrior Project cannot be stressed enough. In these trying times, when we rely on the heroism and sacrifice of our armed forces to protect Armenia and Artsakh, we all have to make sure that our heroes receive the quality care they so deserve. To get involved in helping and to donate to Armenian Wounded Warriors Fund, please visit the web address on our screen or contact via email at info@armenianwoundedheroes.com. Armenian Wounded Heroes Fund covers all administrative costs so that 100% of every dollar donated has an impact and reaches its intended recipient through rigorous monitoring mechanism.